Okay, so good morning, good afternoon, good evening to all of you. Welcome to Data Blitz session B. So this is the session for the Data Blitz session B. If you were planning on going to session A, now's your opportunity to to switch sessions. I'm going to be very brief in introducing the session since we have so many wonderful talks to get through. These are the instructions the speakers have been given. So they have 4 minutes to share the information with you. We have 8 wonderful speakers in this session. And I would like to start by inviting Elizabeth Chan, who will be presenting on subjective well-being shapes US presidential and Senate election outcomes.
Thank you so much for the introduction. Hi, everyone. I'm Elizabeth. It's great to be here today, and I'm excited to present this work I did with Felix on how well-being shapes 2020 US presidential and Senate election outcomes. So previous work by Ward et al. Tested whether counties in which people became less satisfied over time were more likely to vote for the non-incumbent in the subsequent election. Indeed, they found that declines in county level well-being led to voting swings towards the non-incumbent in both the 2012 and 2016 presidential elections. But what about the 2020 presidential election? And are the results different for the 2020 Senate elections? So the 2020 elections were particularly divisive and contentious, with the COVID-19 pandemic and the racial justice movement taking place in the same year that could have affected well-being, and it left voters with an important decision to make about who to vote for. Did they want to stick with the incumbent or vote for a change? We tested these questions in a present study and similarly expected that declines in well-being over time would lead to a greater non-incumbent vote share. Our well-being data came from the Gallup Healthways Well-being Index with nearly 800,000 participants. The data were aggregated to the MSA, or Metropolitan Statistical Area level, and MSAs are collections of counties in the US. The measures of well-being included current life satisfaction, hope, positive affect, and negative affect. So sample item for positive affect might be, did you experience enjoyment during a lot of the day yesterday? And they respond either yes or no. Our elections data came from the Dave Blitz Atlas of US presidential elections, and the outcome variable was the non-incumbent vote share, which refers to the vote share for a candidate from a party that did not win or the party that did not get the majority in the last election. So for the 2020 presidential election, because the last elected candidate in 2016 was Republican, the non-incumbent here would be the Democratic candidate. For the 2020 Senate election, because Republicans got the majority in the 2014 election, the non-incumbent vote share here would also be the Democratic vote share. We conducted weighted least squares regressions controlling for demographic variables, which were mean-centered and included robust standard errors. After centering and controlling for the covariates, the effects largely went in the expected directions, but were not significant. And I'll focus on positive and negative affect, which are on the x-axis. The y-axis displays the increase in the non-incumbent or Democratic vote share. The blue line represents the unadjusted regression, and the orange line represents the adjusted regression. In the 2020 presidential election, you'll see here that MSAs that experienced less positive affect since the 2016 election tended to have larger Biden vote shares with a p-value of 0.07. Let's consider the Phoenix, Mesa, and Scottsdale, Arizona MSA as an example. Note that Arizona was one of the states with the smaller vote margins, with critical votes coming from this region. When we map this MSA onto its respective counties, we see that Trump actually received more votes here in 2016. And from then up until the 2020 election, however, positive affect declined, and in 2020, Biden received more votes in the region. It was the first time since 1948 that this region had more votes for a Democratic candidate. Therefore, changes in well-being might play a role, even if it's a small one, in the election results. In the 2020 Senate election, regions that saw increases in negative affect tended to have a larger Democratic vote share, but there was a p-value of 0.17. So what can we take away from this? We don't have a definitive conclusion right now because the results, while largely in the expected directions, were again not significant. We're currently conducting a more expansive set of studies looking at presidential, Senate, and House elections from 2010 to 2020 at the MSA, county, state, and district levels. And if we find that well-being consistently affects election outcomes, then politicians may be more inclined to consider the well-being of their constituents when seeking election or re-election, and it may highlight the importance of well-being for policy. Thank you so much.
So much, Elizabeth. That was exactly 4 minutes.
Great.
Great job. Our second Data Blitz presentation is associations of personality and internalizing, externalizing in autism spectrum disorders.
Thank you, Aranda. Hi, everyone. My name is Billy, and I'm a postdoc at the UC Davis Mind Institute, working with Dr. Richard Robbins and Dr. Marjorie Solomon. As Aranda covered, my presentation will be on the personality psychopathology association specific to the autism spectrum disorder. So, past few decades, personality psychopathology association has been very well researched in personality research. This is particularly true for the two broadband domains of internalizing and externalizing. Namely, for the sake of, or for the risk of oversimplifying it, internalizing has been associated with high neuroticism, low conscientiousness, and low extroversion, while externalizing has been associated with high neuroticism, low conscientiousness, and low agreeableness. However, these findings and these associations have not been studied within the ASD population, the autism spectrum disorder population. This is a necessary step in the intersection of clinical personality research and autism research for the field to move forward, as well as maybe more specifically to understand how ASD as a disorder may fit into the broader personality research field, as well as the high-top framework itself. So as such, our study here aims to identify and examine the association between personality and internalizing and externalizing within the ASD population. So our study had 164 participants ages 12 to 22, and half of these participants are clinically diagnosed with ASD, while the other half are not clinically diagnosed with ASD. We measured their personality scores via the BFI-2, and we measured the internalizing, externalizing scores via the child and adult behavior checklist, depending on age. We used both the broadband scales of internalizing and externalizing, as well as the syndromic subscales for each of those two domains. In order to test association between personality and psychopathology, we conducted multiple linear regressions for internalizing and externalizing across the two groups. For example, we used, in order to study internalizing, we regressed internalizing on the 3 associated personality domains as we identified in the extant literature. We also tested for interaction effects or moderation of ASD diagnosis with personality domain. So here are the results. For internalizing subscales, anxiety, withdrawal, and somatic, the only predictor of internalizing was neuroticism in this multiple regression model for the TIP group. However, for the ASD group, neuroticism, conscientiousness, and extroversion, all 3 domains were significant predictors of internalizing. In the collapsed model with both groups together, all 3 personality domains had a significant interaction effect with the ASD diagnosis term. For externalizing, agreeableness was the sole predictor of externalizing in the TIP group, whereas for neuroticism, for ASD group, neuroticism was the only predictor of externalizing. And in the collapse model, there were no moderation effects. So this is a very small slice of a larger study that we are looking to conduct. Just to wrap up, we wanted to share that this may have implications in terms of how we understand personality within the ASD population. And importantly, we can start to see a glimpse of how the personality psychopathology association in the ASD population may not be entirely consistent with the general population. So any inferences or implications should really be wary moving forward. And this is something that we should keep in mind for this really small subfield. That's all I've got. Thank you, everyone.
Thank you so much, Anshin. Again, exactly 4 minutes. So we're off to a great start here. Our third presentation is maladaptive conscientiousness is still conscientiousness.
All right. Hi, everybody. So my name is Meredith, and I'm actually presenting on behalf of my advisor, Doug, who unfortunately couldn't be here tonight. But this is a study that we did in our lab, and I really want to highlight before I get into it, Shri, who's the second author on this. She was actually an undergrad in our lab who did this primarily for her research honors project. So she really spearheaded this for us. So there's been a lot of progress in how we understand personality pathology in terms of being maladaptive variants of the 5-factor model. For example, it's pretty widely accepted that antagonism or antisocial personality disorder can be conceptualized by something like maladaptive low agreeableness. But there's still some debate on the link between the 5-factor model and symptoms of OCPD, such as perfectionism, orderliness, workaholism, over-control. A lot of these are conceptualized as just maladaptive conscientiousness. So for example, the FFOCI, which seeks to assess the OCPD from a 5-factor model perspective, has 12 scales, and 6 of those scales are actually representative of maladaptive conscientiousness. And we know that the FFOCI is maladaptive as it correlates with measures of OCPD around about 0.66. But there's a key question out there that is, once conscientiousness becomes maladaptive, is it still actually conscientiousness, or is it just really saturated with neuroticism? There have been critics out there who have reasonably argued that maladaptive measures, when you try to kind of add that maladaptive component to it, like with conscientiousness, it becomes really oversaturated with neuroticism because you're adding a lot of negative affect to that content. So that was something that we were interested in finding out. Essentially, our goal was to compare maladaptive conscientiousness to various measures assessing adaptive levels of conscientiousness, as well as just other 5-factor model domains. So we used an undergraduate sample to do this, and we actually over-selected for high conscientiousness. So instead of having that bell curve, we were trying to get that flat distribution. And they completed a lot of self-report measures, looking at maladaptive conscientiousness as well as adaptive, and then all of the 5 domains of the 5-factor model. And this column right here is our maladaptive conscientiousness. You can see that it correlates pretty well with traditional measures of just adaptive conscientiousness, suggesting that they do share that nomological network with one another. But if you look across, you can see that it correlates a little bit lower than just the general adaptive conscientiousness measures correlate with themselves, suggesting that there is a little bit of a trade-off when you're trying to capture maladaptive content, but that drop seems to be lower in magnitude than what you might expect. Maladaptive conscientiousness also interestingly had less overlap with neuroticism than the measures of general conscientiousness. So the big takeaway here is that maladaptive conscientiousness is still conscientiousness, and measures of maladaptive conscientiousness like the FFOCI do seem to function as a measure of conscientiousness, not just neuroticism. And this can have some really important implications. So I think one of the really neat things about something like the FFOCI is that it can capture adaptive and maladaptive ranges of personality in a single scale, which is an advance over existing measures that might be limited to just one or the other. This can be really important if we're looking at something like bipolarity or a curvilinear relationship, where we might think that, for example, with conscientiousness, there might be kind of this leveling off of you get to a certain level of conscientiousness and then it's actually not as adaptive or functional to have that. So this measure could be potentially helpful for that. That's all I have.
Thank you so much. Our 4th talk is narrative identity and risk for psychosis.
Sorry, I couldn't figure out how to unmute myself. Hi, everyone. I am Raffles Cowan. I'm a PhD candidate at Northwestern and doing my clinical internship at Ohio State this year. I'm interested in narrative identity, so the idea that people understand themselves, at least in part, as authors of a personal life story. But how is narrative identity affected in serious mental illness? Today, I'll talk about narrative identity problems in psychosis and show some data about how these problems might start. So first, let's take a look at how people diagnosed with schizophrenia tend to tell their life stories. So let's take a look at a first quote here. If I'd studied, I probably would have done something important. What a shame. I've spent 16 hours with the books for nothing. So in this example, a lot of suffering comes through. And in fact, many studies have found that the life stories of people with schizophrenia are full of passive language and negative emotions. In narrative identity research, we call these motivational and affective themes. Here's another example. No, what happened there where my father took out gold? We were happy. We used to get up early and it was fantastic cleaning. The thing is, my father had some nougat. This quote's a little bit difficult to follow, and many studies have found that the life stories of people with schizophrenia also lack key contextual and temporal details to allow the listener to follow the flow of the story. We would say that they have poor narrative structure. In this last quote, it's sort of dreamlike. My thoughts, my emotions, my actions, none of them belong to me anymore. You might get a sense that this person is sort of at a distance, disconnected from the story they're telling. And this reflects problems with autobiographical reasoning, another key dimension in narrative identity. So in schizophrenia, we know that all three of these dimensions are affected. My question for today is, do these problems with narrative identity predate the onset of psychosis, or are they consequences of psychosis? So to get at that study, we looked at young people at clinical high risk for psychotic disorders. These are individuals who don't yet have clinical psychotic symptoms, but they show early warning signs, typically some combination of attenuated psychotic symptoms, genetic risk, and recent functional decline. Left untreated, many of these people will have a true psychotic episode within a few years. So here's the question. Are the narrative identity problems we see in psychosis already present in these young people at risk for psychosis? So to find out, we did a life narrative interview with 42 help-seeking individuals who met clinical high-risk criteria and 44 matched healthy controls. Trained raters scored each transcript on 6 narrative identity themes, 2 themes from each of those 3 dimensions we saw on the last slide. The interview also had different sections about different kinds of experiences, so we used multi-level modeling with interview sections nested within participants, which allowed us to test whether narrative identity problems might appear in some kinds of personal stories, but not others. So what did we find? Don't pay too much attention to the values. They're coded on separate scales, so they're not directly comparable, but look at the group differences between clinical high risk in dark blue and controls in light blue. On the motivational and affective themes, we found the same pattern of negativity and passivity that we see in individuals with schizophrenia. So these problems at least do seem to predate the onset of a psychotic disorder. On the structural themes, we found some potential more subtle effects. One of the 2 themes had a trend level group difference and the other had a group difference, but only in one specific section of the interview. And finally, autobiographical reasoning was actually completely unaffected. So it seems like some narrative identity disturbances predate the onset of psychosis and others follow along once the person is already experiencing a psychotic disorder. These sort of motivational affective problems seem to come first. Narrative structure problems may actually start to kick in around the same time that a psychotic disorder is developing. And then the autobiographical reasoning problems may come last after those other 2 dimensions have broken down in a clinical psychotic disorder. So I think this is a really exciting illustration of how these really profound problems with self and identity begin in the very earliest stages of serious mental illness. And I see Aranda's face. So thank you for your time, and I'll pass it on to the next speaker.
Yet another perfectly timed talk. Thank you so much. Our 5th Data Blitz talk is why do people seek information? The role of personality traits and situation perception.
Hi, everyone. So just checking everyone can see the screen and not the presenter view. Yeah, sure, that's okay. Great. So during lockdown, this picture was often my Zoom background. And whenever I had meetings, people would ask me where in the world this incredible place was, even though they were all stuck at home, unable to go there. So this is an example of what is called non-instrumental information seeking. So that's just information that has no obvious extrinsic utility. And now understanding why people seek information is a key focus within the fields of decision science and cognitive neuroscience. So researchers within these fields have a few different explanations for why people might seek information. So one explanation is that people want to reduce the aversive feelings of uncertainty, while another is that people are simply curious to explore. So my colleagues and I decided to take a personality psychology lens to this topic by proposing that rather than assuming that only one explanation is relevant to all people, both explanations could be relevant depending on the person and the context. So to look at this, we designed a study where participants completed multiple information-seeking paradigms that are commonly used in the literature, thus varying the context. So one of these was a trivia questions paradigm, where participants had the opportunity to pay in units of time to see the answer to the question. And another was a paradigm where participants had the opportunity to learn a little bit in advance, whether they had correctly chosen heads or tails in a coin flip. And I've called this a reward outcome paradigm because you learn the outcome of your reward. So finally, we included 2 additional paradigms where to account for possible confounds with the trivia paradigm. Now, crucially, because these paradigms all measure non-instrumental information seeking, we might expect to see similar distributions of choice preference and similar relations to personality traits. However, that's not what we observed. Instead, we can see here that information-seeking preferences differed markedly across the different tasks. And we also measured participants' perceptions of the task using the Diamond's measure of situation perception and found that the trivia and related tasks were rated as more intellectually engaging, more positive, and less negative than the reward outcome task. So the takeaway from this is that we should be wary of sticking to one paradigm when proposing explanations for information seeking, because we might only be seeing part of the picture in terms of potential cognitive, emotional, or motivational affordances. So we also measured Big 5 personality traits, as well as trait curiosity and intolerance of uncertainty. And we found here that openness intellect and the curiosity facet joyous exploration predicted seeking information for the trivia tasks, but not the reward outcome task. Now, this finding has relevance for an existing theory linking openness intellect to information seeking. So previous studies haven't found that openness intellect predicts information seeking, but those studies mostly use reward outcome tasks. So this actually replicates that past research, but also shows that in contexts which afford positivity and intellectual engagement, openness intellect and curiosity predict information seeking. Just they don't seem to in situations which are rated as less intellectually engaging and less positive. And finally, we also looked at uncertainty and tolerance, which we thought would predict information seeking in the reward outcome, but not the trivia paradigms. However, this hypothesis was only supported in study 2, providing only tentative evidence. So in summary, this study demonstrates how integrating theories and methods across decision science and personality psychology can lead to insights for both fields. And finally, for those people who still really wanted to know where my Zoom background was, it's called Mount Anne in Tasmania. So if Australia ever opens our borders, shoot me an email and we can go and visit. That's all for me. Thank you.
Thank you so much. Yet another perfectly timed talk. So our next talk is Identity Theft, a new direction in the study of narrative identity. And actually, before John starts his talk, are you able to access the chat function?
No.
No?
Nope.
Okay, that is okay. So we'll continue with our discussion with our session, but maybe we'll do a regular Q&A at the end of the session. So John, take it away.
All right, thanks so much. Can you see me okay? Are you seeing me, Miranda? All right, I'm gonna assume everything's fine. Okay, great. So, so I study narrative identity, so it seems fitting that I should open this talk with a story. So this is Carol. The summer that Carol turned 63, she and her husband went to the same cabin in Maine they'd been renting for years. One evening, she had some heartburn that just wouldn't go away, and as it approached bedtime, the pain got bad enough that Carol finally let her husband convince her to go to the emergency room at the small hospital nearby. Carol woke up 6 months later in a Boston hospital, having been airlifted there after being the 1 in a million person who has an adverse reaction to the common medication they had used to treat her mild heart attack. She had been in a medically induced coma, having had 7 surgeries, and ultimately had amputations to both legs and parts of both hands. When I conducted a life story interview with Carol a few years later, she described the ways in which the experience completely undermined her identity. She said, When I was laying in the hospital, I'm thinking to myself, how am I going to do Christmas dinner? Christmas dinner? How am I going to go to the bathroom by myself tomorrow? You know, I'm living a life I didn't agree to. I mean, this is totally not fair. At this point today, I'm totally healthy. I mean, there's nothing wrong with me, not bleeding, not on chemo, you know, I'm fine, just missing parts. So to need so much help when I'm fine is weird, you know? I don't think of myself as an amputee. You look at me and think, well, how could you not? But I'm surprised when that smacks me in the face each day. I'm living a life I didn't agree to. The changes to Carol's body had stolen her identity. And this new identity had its own agency. It smacks her in the face each day. Now, I've been studying narrative identity in people with acquired disabilities for the past few years, and many of them don't feel this way about becoming disabled. But Carol's experience resonates with a surprisingly broad and eclectic range of people who have this experience I'm calling identity theft. So there are people who are wrongfully convicted of crimes they didn't commit, even though the world insists they did. There are spies who get so invested in the assumed identities they've taken on that they actually relinquish their prior selves. There are people who are born intersex who don't discover it until puberty and have to completely rethink their gender identity. There are reality TV stars who get edited into villains they can't recognize in themselves, even though everyone else sees them that way. In each of these extreme examples, and many others, there are different thieves, but in each case, there's a narrative identity that gets away from the person living it. So these are certainly extreme examples, but they may reveal important insights about normative narrative identity processes. So indeed, we're born without words, let alone stories. So external narration is actually all there is early in life. Over the course of childhood, we practice co-narration, sharing the role of narrator with our parents or caregivers who help us learn how to make sense of our lives. And in adolescence and emerging adulthood, identity formation processes cue the emergence of narrative identity when we first become the narrator of our own lives. But this notion of the person as narrator of their life story may over-prioritize independence while ignoring our fundamental interdependence. That happens to be a very important insight I've gleaned from working with people who have significant physical disabilities too. The work of Kate McLean and others demonstrates that we're always negotiating our identity in the context of interpersonal relationships and within many layered axes of cultural master narratives. So co-narration may actually be the default state, and these extreme examples help reveal the contours of these processes. They cast general principles of narrative identity into stark relief and ask us to consider whether we are, in fact, the narrator of our lives or only the first author. So I'm working on a qualitative project now to begin to explore these issues, and I'm so grateful to have had the opportunity to give you this little window into the project. More to come. Thanks.
Thank you so much. Okay. Before I move on and introduce our seventh speaker, I just want to note that the chat function now works. So please, if you do have questions, send them Nick's way. Okay, our seventh Data Blitz talk is Narrating Life in the Military, Links Between Veterans' Narrative Processing of Service Experiences, Post-Traumatic Stress Disorder Symptoms, and Well-Being.
Cool. Everyone, I'm going to be talking about a project that I worked on at Colgate University with my advisor, Professor Rebecca Scheiner, and a fellow classmate, Fanny Mo. So PTSD is a disorder with tight links to memory and recall. As such, the ways that people reflect back on their highly stressful and traumatic events may be important in determining the level to which they are affected by PTSD symptoms because of that event. Inspired by this possibility, there have been some past research efforts to study whether anything can be learned from written narratives about traumatic events. These are called trauma narratives, the way that people remember their traumatic events in written form. However, results from past trauma narrative research has been inconsistent. This past research, however, has not applied the methods of narrative identity from the personality tradition that we've heard a little bit about already. So the goal of the present study was to fill this void, to investigate the relationship between the narrative processing variables of growth, agency, communion, and coherence, and various post-discharge functioning outcomes, including PTSD and a sample of US military veterans. We hypothesized, based on the findings from previous narrative processing studies, that narrative growth and agency would be associated with fewer PTSD symptoms, less depression and anxiety, less impairment in daily function, and higher well-being. We also included the communion and coherence variables as exploratory variables. So the study itself was, we utilized the online survey company Qualtrics to recruit a sample of 154 US military veterans who had served in a variety of theaters, such as Vietnam, Iraq, and Afghanistan. Though it should be noted that not all the participants served in the combat theater. The average age of the participants was 64. So to participate, the veterans were sent a link and via email to the survey. And after giving informed consent, they were prompted to write at least one paragraph about 2 different events from their service. So these were the narratives: one highly stressful event from service and one key scene event from service. So after writing the narratives, they completed self-reports to assess PTSD symptoms, depression and anxiety symptoms, well-being levels, and functional impairment levels. So once participation was completed, the narratives were then obviously collected from the participants, and they were coded for the 4 narrative processing variables that I mentioned. So growth, agency, communion, and coherence. And these are coded by trained members of the study staff. So bivariate correlations between each narrative theme for each of the 2 narrative types and each outcome variable confirmed our hypotheses for the highly stressful narratives. So narrative growth in the highly stressful narratives was negatively associated with PTSD symptoms, depression and anxiety symptoms, and functional impairment symptoms. It was also positively associated with well-being. In addition to this finding, agency in the highly stressful narratives was negatively associated with PTSD symptoms, depression and anxiety symptoms, and functional impairment. It, however, was not associated with well-being. Also, communion and coherence were not associated with any of the outcome variables for either of the narrative types. So there are several key takeaways from these results. The first, and in my opinion, the most interesting, is that these findings indicate that veterans who reflect back on highly stressful events from their service in ways that highlight avenues for personal growth are less likely to suffer from PTSD symptoms and other post-discharge ailments in the present. The fact that many of the veterans in the study were from conflicts that were decades ago makes this finding even more striking. It highlights that despite the passage of time, it is still beneficial to highlight growth when reflecting back on stressful events. It also shows that veterans who convey autonomy and control, so this is the agency piece when describing a stressful event from service, are less likely to have been negatively impacted by these events. And lastly, a last important takeaway is that the narrative identity research methods are a worthy tool for studying trauma narratives. So applying the narrative identity lens to trauma narratives is an effective, at least based on this study, effective and worthy manner in which to investigate them. So thanks everyone.
Thank you so much. Our final Data Blitz presentation is trait regulation goals examined with in-person variability in the desirability of personality expression.
Thanks, Miranda. So I'm Reb Rebely. I'm finishing my PhD at the University of Melbourne under the supervision of Pete Cavall and Luke Smiley, and I'm going to present some work from a project today that's part of that dissertation. So what we're looking at, the sort of core research question is actually, if I can go back a bit here, how often and under what circumstances do people set goals to express different aspects of their personality? So we're building on a lot of work here in personality dynamics, particularly over the past couple of decades. So what you see here is a trait density distribution of somebody who scores sort of about average, slightly moderate on trait extroversion. And if we did experience sampling, we would find that this person who is somewhat extroverted on average will express extroversion to varying degrees over the course of daily life. So on Friday night, they might be expressing their extremely extroverted self. On Sunday afternoon, they might be in a more introverted state. And really, the sort of question we're asking is some of this movement intentional or deliberate, or sort of the product of goals to shift from one expression of one's personality to another? And so we're building building on work that shows that these states vary according to changes in situations, changes in motives, and work on emotion regulation, which suggests that people effortlessly regulate their affective states. Well, if they effortfully regulate their affective states, why wouldn't they effortfully regulate their personality states? So to investigate this, we've done a couple of studies now. I'll present 2 of them today. So the first study I'll present is actually a pre-registered replication and extension of a pilot study we did. This is with 276 participants on MTurk, where we asked people to try to recall times in the past month where they may have wanted to bring out different sides of themselves. So we asked about expressing or suppressing each of the big 5 traits. And I've got an example up here where we talk about extroversion. So first we define what extroversion is. The personality trait of extroversion reflects the extent to which you tend to be enthusiastic and assertive. How often have you wanted to bring out a more extroverted side of yourself in the past month? That is, how often have you deliberately wanted to behave in a more extroverted way? And we give an example of what that means. And our hypothesis was that most participants will report having held most trait regulation goals of the ones that we've asked about at some point in the past month. Now, recognizing that trying to recall these momentary goals has some real limitations, our next study was to do an experience sampling study where we asked people in daily life 5 times a day for 10 days, right now, how conscientious do you want to be? Right now, how extroverted do you want to be? So we had a question for each of the big 5 traits. We also asked about their concurrent motives, their affect, the situation that they were in, and also what personality states they'd recently been expressing. And here our key hypothesis was that there would be substantial within-person variance in the degree to which people would want to express each of the big 5 personality traits at different times in daily life. So we're really just trying to get at what are your goals in the moment, report them as they occur. So some results. So first, from the retrospective study, we find, as we expected, that most participants report that they've held most of the trait regulation goals that we asked about in the past month. The chart that you see here sort of shows the frequency. So as you might expect, people want to had goals to express the sort of more socially desirable sides of traits more often, but they also reported having goals at least once in a while to express even traits like neuroticism in that momentary state. Then some results from the experience sampling study. So we do find some significant within-person variance in the trait regulation goals that people held. And if you look at the ICC score, we try to partition out that variance into within versus between person factors. And we find that most of the variance in daily life in these trait regulations goals is explained at the within-person level. Similar amounts of within-person variance to personality states and even affect. Exploratory analyses in these studies shows that this variance within persons can be explained in part by both changes in momentary situation motives and also by between-person differences in traits and trait change goals. So we think this has implications for research on personality dynamics and processes, and I look forward to discussing it with some of you at later events. Thanks for your time.
Thank you so much. Okay, so we have around 6 minutes of questions. I have received a couple of messages in the chat. If you have any questions that come up in the next few minutes, please send them my way, and I'd be happy to ask them. So the first question we have is for Haley. Did you find whether extroversion, especially assertiveness, the facet of assertiveness, predicted people's choices in the coin flip task, but not the trivia task? You're muted, Haley.
I didn't see any significant relationships with extroversion and information seeking in either of the tasks.
Okay, thank you. Our next question is for Elizabeth. So the question is, based either on past research or on the analysis you have done, is there a consistent link, a systematic link between positive affect and negative affect and support for progressive or liberal parties? So for example, does increased negative affect lead to increased turnout for Democrats, whereas lower positive affect dampens support for Republicans? So I guess the question is have you found a systematic relationship between positive and negative affect and either increases or decreases for support?
Yeah, thank you so much for the question. I'll say at this point, we're still doing the analyses to look at multiple elections, and that's something that we would definitely consider breaking it down into those different well-being variables and the election, the different parties. But it's not something that we've seen a consistent or some sort of systematic link at this point. I know some of the prior work that I mentioned that found this link in general between well-being and election outcomes, they found that it was strongest for life satisfaction and hope, actually, rather than the affective variables. But yeah, that's something that we'd be interested in looking at for our larger set of studies that we're doing. Thank you.
Excellent. And regarding life satisfaction and hope, is it associated with sort of positive support or dampening of support? So is it a positive relationship, or is what we call, if life satisfaction goes down, people don't vote, or people don't vote for a particular party? Would you happen to know what the nature of the relationship is?
Yeah, when it comes to voter turnout, that's not something we really looked at in this study, but I know in a prior study, they did find that that those who were more satisfied were more likely to go out and vote and participate in politics, not necessarily becoming apathetic, but it would be interesting to see how it looks the other way around. If people are less satisfied, does that make them apathetic? But yeah, that wasn't in the scope of the present study. Yeah.
Thank you so much, Elizabeth. We have a question for Peter. The question is, could you elaborate more on the coherence of narratives? In my research on war survivors in Bosnia and Herzegovina, the majority were not capable of producing coherent narratives, while in terms of memory for war events, phenomenological characteristics dominated. So for example, I can smell the grenade, I see it as red, instead of saying words like blood, etc.
That's interesting. Yeah. So for the coherence variable, we measured it based on 3 aspects of the narrative. So the first was context. So did the narrator emphasize or indicate a time and a place in the narrative? The second was chronology, which is, did it follow a clear timing structure? So it was the timing of the events in the narrative clear to follow? And the third was theme, which was there a purpose to the narrative? And so based on those 3 aspects, we conducted a score for coherence.
Okay, thank you.